So because of that test, as soon as I had breast cancer and I knew I was going to have to have a mastectomy, and the side that I had cancer on was my right side, immediately I said I want them both off. I just knew I wanted a double mastectomy. And until I had the test, I might have had to fight with the insurance company to have the other side removed, but I thought, I don't want to deal with this again. I was really concerned about symmetry. I didn't want one breast on and one breast off, and so it was a really big deal. Well, once I was BRCA positive, there was no question that I was going to have both removed. And so they also wanted to do what's called neoadjuvant chemotherapy. So when you are diagnosed with cancer, you will either have surgery and then chemotherapy, but because of my age, I was young, and it was a very large tumor, and the stage of it, they want to do what's called neoadjuvant chemotherapy, so chemotherapy before the surgery. And the reason they do that is to see if your tumor's reacting to the chemotherapy drugs. They're looking to see if it's going to get softer or smaller. And I was super fortunate. My tumor was really responsive, and I kind of hit the lottery of breast cancers. So I was what's called ER/PR positive and HER2 negative. So HER2 is a protein that's around your cells. And many years ago, women who were HER2 positive did not have many things available to them. It was one of the things they used to die from. They've since created a therapy, and women who have that get infusions of that for up to a year after their chemotherapy starts. But in the world of cancer, if you're going to get breast cancer, having estrogen and progesterone positive, that's the ER/PR piece, and HER2 negative is kind of the best case scenario. So even though I had advanced cancer, the rest of the profile around it was good, and my tumor responded. And so I had a portacath put into my chest for all the chemotherapeutic drugs to be going through, because I was going to have some of the most intense chemotherapy they could give based on my age and the stage of my cancer. And then we talked about what do I want to do afterwards.